If you're turning 65 soon, one Medicare deadline matters more than almost any other. Miss it, and you could face delayed coverage, late enrollment penalties, or unnecessary stress trying to fix it later. The good news? Once you understand your Medicare enrollment timeline, it's actually pretty straightforward. In this video, I'll explain when you should enroll in Medicare, who can safely delay enrollment, and the costly mistake many people don't realize they've made until it's too late. Let's get started. For most people, Medicare enrollment starts with something called the Initial Enrollment Period, or IEP. This is your first opportunity to enroll in Medicare. Your initial enrollment period lasts for 7 months. 3 months before your 65th birthday month, your birthday month, 3 months after your birthday month. Here's an example. If your 65th birthday is in October, your enrollment window begins July 1st and ends January 31st. Many people assume they can wait until after their birthday to think about Medicare. That's one of the biggest mistakes I see. Starting early gives you time to compare options, avoid delays, and make sure your coverage begins when you want it to. One of the most common questions I hear is, will Medicare automatically enroll me? The answer is sometimes. If you're already receiving Social Security retirement benefits before age 65, Medicare Part A and Part B are usually automatic. You'll typically receive your Medicare card before your coverage begins. But if you're not yet collecting Social Security, you generally need to enroll yourself. And many people don't realize that. They assume Medicare will just show up automatically. Sometimes it does. Sometimes it doesn't. Knowing which situation applies to you is critical. This is where things get a little more interesting. Many people continue working past age 65. If that's you, you may not need to enroll in Medicare right away. In many cases, you can delay Part B if you have qualifying employer coverage through active employment. But there is an important detail. The size of the employer matters. For many people, employer coverage from a company with 20 or more employees may allow them to delay Medicare without penalty. This is why blanket advice on the internet can be dangerous. Two people can be the same age and have completely different enrollment rules depending on their employment situation. Let's talk about some of the mistakes that can create problems. Mistake number 1, assuming Medicare is automatic. As we discussed earlier, that's not true for everyone. Mistake number 2, missing your initial enrollment period because you thought employer coverage works differently than it actually does. Mistake number 3, not understanding how Medicare works with other coverage, including employer plans. Mistake number 4, waiting until you need medical care before looking into Medicare. By then, deadlines may have already passed. Depending on your situation, missing Medicare enrollment deadlines can lead to delayed coverage gaps, late enrollment penalties, and some penalties can follow you for years. That's why planning ahead is so important. The goal isn't to enroll early or late. The goal is to enroll at the right time for your situation. If you're approaching age 65, ask yourself these questions. Am I already receiving Social Security? Am I still working? Do I have employer health insurance? How large is my employer? When does my current coverage end? The answers will help determine when Medicare enrollment makes sense for you. If you're turning 65 soon, don't wait until the last minute to figure out Medicare. Understanding your enrollment window now can help you avoid costly mistakes later. And remember, the right enrollment timing depends on your specific situation. If you found this video helpful, subscribe for more Medicare education videos. And if you'd like additional Medicare guides, checklists, and resources, visit RobinsWisdom.com. Thanks for watching. I'm Robin Dall, and that's Medicare minus the headache. See you in the next one.